She fell, she hit her head on a couch, she had a stroke. It was not planned.
Christina Keys gave up a successful career to care for her mom full-time. She says the state's new long-term care fund would have been a huge help.
It would have been a life changer.
But Washington Cares and its mandatory payroll tax have been put on hold as state lawmakers work out a plan for those who may not benefit after paying in.
We want to make sure we get it right.
But other lawmakers want to replace the plan entirely.
The program is just unsustainable.
Will the effort to be the first state in the country to mandate long-term care coverage succeed?
It's not everything, but it can make a big difference in people's lives.
Our panel of experts weighs in.
It does not necessarily meet the needs.
The urgency to fix and finance the ambitious Washington Cares Fund. Next on City Inside Out. Welcome to this edition of City Inside Out. I'm your host, Brian Callanan. A state-run program that would provide long-term care insurance to all Washingtonians, the first measure of its kind in the nation, has turned into a long-term battle in Olympia. Legislators passed the Washington Cares Bill in 2019, but its implementation stalled last year as hundreds of thousands of residents decided to opt out of the coverage. State Democrats say they can fix Washington Cares and make it a better deal, but Republicans say it's time to repeal and replace the program with a privately managed option. This session, get ready for a renewed fight from both parties over the best way to protect Washingtonians of all ages from a looming long-term care crisis. When her mom had a stroke in 2013, Christina Keys thought her tech job salary plus her mom's insurance through Boeing and their combined 401ks would be enough to cover long-term care. She was wrong.
Within a year and a half, it was all gone, just paying for the things that were not covered by Medicare and her supplement.
That's part of the reason Keys says state residents need Washington Cares.
We went from middle class to poverty level.
Passed by the legislature in 2019, it's the first state-run program of its kind in the U.S., providing up to $36,500 in benefits to Washington residents via a 0.58% payroll tax.
It would have been a life changer for me. $36,000, trust me, never earned that much in any of my GoFundMes or my garage sales.
But as the deadline to show proof of private coverage neared last November, or default to the state's payroll tax program in January, 450,000 Washingtonians asked to opt out and flooded insurance brokers with so many requests for long-term care coverage. Many stopped selling such policies in our state altogether.
A lot of people want affordable coverage, but a lot of people want optional coverage too. They don't necessarily want this product.
State Representative Drew Stokesbary, a Republican from the 31st District in Auburn, says people who work in our state but live in another would pay for but not receive benefits under Washington Cares. And those near retirement would have to keep working 10 years to fully vest in the program.
It's just a fundamentally unfair system.
How is that premium calculated?
Democratic lawmakers have proposed two measures to fix Washington Cares. House Bill 1732 would delay its implementation until July of next year. House Bill 1733 would allow for more exemptions, including people who live out of state and military families.
The program is just unsustainable.
But Stokesbary says beyond those changes, the math doesn't add up. He says Washington Cares' tax rate would have to grow significantly to keep up with rising costs for long-term care. His House Bill 1913 would repeal and replace Washington Cares with a privately managed program where the state would give tax credits from existing revenue to insurance companies as a way to provide long-term care coverage that anyone could opt out of.
And the proposal I'm trying to put forward is a way to make coverage affordable for those who want it, but optional for those who don't.
There's some revisionist history going on here.
Representative Pat Sullivan, the Democrat from the 47th District in Covington, says the state's research on private insurers 3 years ago, when Washington Cares was approved, revealed plenty of problems.
The private market was so unstable, we could not find a way to make that work. And that's why the long-term care trust came into being.
Sullivan is sponsoring the measure to delay the implementation of Washington Cares and says the program can be fixed by next year.
We want to make sure we get it right.
He believes this payroll tax-based plan is the answer to an impending long-term care crisis and says replacing it with an opt-in program is a bad idea for anyone who pays taxes, not just those in need of care.
A lot of these people are going to wind up on public assistance, which actually costs the state more money in the long term.
That's not the only cost, says Christina Keys.
30% of caregivers under the age of 65 are going to pass before the person they're caring for because of the stress.
She's pushing state lawmakers to help her family and thousands of others before it's too late.
Stop talking and start doing something. People are dying.
And joining us to further discuss this issue, we have with us Ben Veghte. He is the director of the Washington Cares Fund for the Washington State Department of Social and Health Services. Ben, good to have you. We also have with us Amy Anderson. She is Government Affairs Director for the Association of Washington Business. Good to have you too, Amy. Ben, I want to start with you with an overview, if I could. So in its current form, Washington Cares would cost the average worker about $24 a month and provide them with up to $36,500 in long-term care benefits. It would be the first state-run program of its kind in the U.S., and it has raised a lot of questions and concerns, which we will get into. But just to begin here, why is Washington Cares needed? Why do you think it's important?
Well, thank you for having me, Brian. Well, 7 in 10 of us will need long-term care as we age. Assistance with things like eating, bathing, dressing, things that enable us to stay in our own home and live independently in the later years of our lives, or in case of an accident or illness during our working years. But most of us don't have a plan to pay for it. Only about 7% of Washingtonians can afford private long-term care insurance. And most of us don't want to spend down our life savings to have to go on Medicaid for support. And so it's a real problem. And with the age wave coming, more and more families are going to be affected by this. And when it does hit a family, it can be devastating financially. It costs $30,000 or more for the care, and it affects not only the person who needs the care, but often their spouse or children have to reduce their work hours or quit a job or move across the state to care for them, which can have a big effect on their lives. So with the WA Cares Fund, everyone will have access to affordable long-term care insurance for the first time. And it does have a cost, of course. There is a premium, like any insurance, but it's an affordable premium. What it does is, instead of us all paying out of pocket when we need care when we're old, we pay in a little bit out of every paycheck like we do for Medicare or Social Security.
Okay. All right. Thank you for breaking that piece down. So, Amy, I'll go to you here. The Association of Washington Business wrote to Governor Inslee last September, outlining a number of concerns about Washington Cares. Dozens of businesses, local governments, labor unions signed on to that letter that you wrote him. I want to talk about it, if you could, and keep it a brief summary to begin here, if you would, Amy. Can you tell me your top concerns with Washington Cares before we get into what the legislature's working on this session?
Sure. Thank you, Brian. And completely agree with you. We have an issue. We have a long-term care issue. And our biggest concern with this piece of legislation, this program, is it does not necessarily meet the needs. It's a limited benefit. The program is currently not solvent, so there's some serious concerns with that. We're collecting money, but we may not be able to deliver on the actual services needed. And it's really not getting to some of the key systemic issues of why we do have a long-term care issue. So working through this is going to be extremely critical because we do, as Ben mentioned again, we've got a lot of folks who need these services and will more so in the future.
Thank you for that. I'm going to break down some of the different issues here that the legislature is working on. And Ben, I'll start with you here. So 2 bills the House just recently approved as of the recording of this program. House Bill 1732, which would delay the implementation of Washington Cares until July of next year, and House Bill 1733, which would allow for more people to opt out of the program. I know the Senate's working to push these through very quickly, too. I just want to ask this question, though. Do these bills answer the concerns we have heard from people? And some of them Amy brought up, too. We've got these folks who live elsewhere but work in Washington. You've got people near retirement age who say they can't fully vest in the program here. Do these bills answer the concerns those people have?
Absolutely, Brian. We've heard those concerns over the past year. We have an oversight body, the LTSS Trust Commission, which meets quarterly and has been, we pass on, when we hear concerns from constituents, we pass those on to that body. And over the past year, they have been considering ways to address the concerns of Washingtonians. We're the first state to do this, so of course there's some fine tuning needed. And what's the bills that you mentioned are implementing essentially the recommendations of that commission. And because this is an earned benefit, you have to pay in order to be eligible. Initially, people close to retirement were concerned they might be paying in for something they might not be able to get. But these bills make it possible for people close to retirement to get benefits. So that's really important. And there are also some groups of people who would have paid in, but not plausibly probably not been able to receive benefits, like people who live in Idaho or Oregon and work in Washington would have paid in, but unless they lived in Washington when they were older, they wouldn't be able to get the benefit. So these bills give them an opportunity to get an exemption from the program so that they wouldn't have to pay in. So those are the kinds of things these bills address. And they do address them in a very efficient, precise manner, and makes the program is solvent through the 2070s. So that's long after we're all no longer here.
Okay.
So
and I'm going to talk about that solvency piece in just a minute here, Ben. And I will also mention, as I talk to people at home here, an important issue that we need to point out here. The legislature will be allowing employers who have already paid into the program to refund employees who've already had money taken out of their paychecks. That's something you're going to be watching for. Amy, I want to go to you next here. You testified recently in favor of putting this pause on Washington Cares. Why was that? And what's your message to the legislature now that the House has approved this pause? The Senate looks like it's going to do that too. This pause and these additional opt-outs. Your thoughts on this?
Yeah, well, as you mentioned, we sent a letter to the governor in August with the organizations, businesses, labor unions across the state requesting a pause because the program is currently, as written, extremely problematic. We had, as Ben mentioned, some of the issues as you did as well. Employees working in Washington State living outside who cannot access the benefit. The opt-out process was a little problematic at first. So we fully supported a pause in collection of the taxes so that we can address the issues and really find some key solutions. Also supported, which 1733 does, including additional populations such as military, temporary workers, and out-of-state employees. So both these bills do meet some of those needs. But yes, we need to go a little bit further. As I mentioned in my testimony, there are some systemic issues we have to deal with long-term care. We do not have a workforce necessary that will meet the needs of our long-term care. We don't even know what long-term care really is. What it was 20 years ago is different than what it is today and different than what it will be going forward because of all of our healthcare advancements. And then finally, we do have some concerns with how insurance regulations, we have very restrictive insurance regulations in the state of Washington. And that's what's stymied the ability for the private long-term care product market to actually meet the needs of Washington State residents. Okay. So that, we need to start taking a look at those to really meet all needs of all Washingtonians.
All right. Well, and Ben, maybe we can break down some of these issues. And I wanted to make sure we talked about this piece first about people being able to opt out of Washington Cares, because critics of the program would say the math doesn't add up here. You got fewer people who are involved in the insurance pool. The fund wouldn't generate as much money. It would be harder to deliver benefits. I'm just looking at that number of people last year. As I've seen it reported, 450,000 people applied to opt out of Washington Cares last year. Can this program survive with 450,000 people opting out?
Yes, absolutely, Brian, because the way this works, this is a long-term, it's a permanent program like Social Security or Medicare. So the people who opted out, in 10 or 15, 20 years, almost all those people will have retired. And so in 20 years from now, there won't be, there'll be almost no one opted out, right? This is a temporary phase of where that population was able to opt out. This is designed to be a universal program, like you say, kind of like Social Security or Medicare. And the way that the problem that this program is addressing is how to make long-term care affordable for all Washingtonians. Private long-term care insurance, not just in Washington, but anywhere in the country and anywhere in the world, is only about less than 10% of people are able to afford it because it's very expensive. When everyone is in the risk pool, or virtually everyone, it makes the premium much, much lower. And so that is what this program achieves. And it will be able to do that over the long term, even with the people who opted out last year.
Got it. I want to make sure that I go to Amy on this one. Do you have some thoughts about Washington Cares? Is it going to be solvent in its current form? I know some Republicans have had this plan to repeal and replace Washington Cares with this opt-in program managed by private insurers. That really didn't get off the floor, but I want to make sure that I lay that out there too. Thoughts about the solvency of this program and what some of the Republicans in the House have been talking about with this?
Yeah, and respecting the current analysis of the program, the actuarial analysis that we have in place right now has not taken into account those opting out, as well as including additional populations who do not have to pay into the program. And I do want to touch on a piece of, we talk about this being a program like Social Security. One of the concerns is this does not have a cap. So for high income earners, the amount of money they're paying in is nowhere near the benefit they're going to get. And in actuality, if we could allow that to be used for purchasing of a more robust private long-term care product, or even an investment into a health account of some sort that would take care of these costs, that would be better and cost saving for Washington State, because you have another product that's taking care of some of those needs, which can get extremely expensive. This is a one-time $36,500 benefit. And if we all understand the cost of long-term care, that's not going to go very far. We really don't want to bankrupt our folks to get them into the Medicaid program, just to get to this piece of it.
Okay. Ben, maybe you can answer some of these concerns here, because it sounds like we're going down this path possibly of discussing what's going on with a privately managed program. I know Representative Stokesbary was talking about this too. This whole idea of allowing private insurance more of a role in this, having it as an opt-in system rather than opt-out. Your thoughts on this, maybe answering some of the concerns that Amy brought up here?
Sure. Amy made a great point about the benefit being modest. It's a modest benefit, and it's important that we're working with private insurers right now to develop a supplemental private market that would supplement the WACARES program. Kind of like with Medicare, you have Medicare supplemental or Medigap insurance, and those discussions are going very well. And we're hoping to develop a market in the future where people can buy an additional $10 or $20 or $50,000 of insurance on top of their WACARES plan if they would wish to. Unfortunately, the idea that the private insurance market could replace WACARES is simply false. It's completely false. There have been 40 years of attempts to help to find different ways, and many ways have been tried to enable the private insurance market to cover the broad middle class. It hasn't worked anywhere, despite significant efforts to attempt that. And in our state specifically, there was a process between 2014 and 2019 where that option was looked at closely by the legislature as an alternative to this idea of a universal program like WACARES. And it was determined that could never cover more than about 10 or 15% of the population. That private insurance works really well for high earners, but it doesn't address the problem that most of us can't afford it. And that's why WACARES was enacted.
Okay. I guess just in looking at this, Amy, and just talking a little bit more about private insurance here, this is the research that the state did. They clearly talked with insurance companies to try to craft this legislation and move it forward here. Do you have an idea of what changed between 2019 when WACARES was introduced and now that would have people think, yeah, having private insurers more involved would be a good idea? Some thoughts on that?
Sure. The original legislation, the establishing legislation in 2019, AWB was supportive of. The business community was fully supportive because it did provide a product for people in Washington who needed it, to get them a bridge product to get them to Medicaid or other services that they might be eligible for. The problem is in 2020 and then the 2021 legislative session, putting in that limit on the opt-out is what completely decimated the long-term care market. It collapsed. The carriers stopped providing products. Having a rolling opt-out so that you should stimulate the market, getting people to get out there and purchase their own long-term care products was the intent of the 2019 legislation, one of the intents. I think a big piece of it, and Ben and his team do a really good job of this, is educating the public on long-term care needs. We don't think about those things enough. And so I think the work they do on that is critical. And we have to have options, though, for people in Washington State, not just one state-run program.
Ben, maybe we can touch on this one more time, this whole concept of opting in versus opting out. I think that was a big part of the issue, why a lot of people decided to opt out last year. Maybe they weren't fully informed about this. Some thoughts about opting in versus opting out?
Sure. Unfortunately, if you have a voluntary program, and I know voluntary sounds great. I prefer voluntary things in my life too, whenever it's possible, right? We all want that. But unfortunately, with insurance, if when it's voluntary, it becomes very expensive. Because this was tried at the federal level, and the Affordable Care Act, there was a component which was for long-term care, which they had to rescind a couple of years later because it was voluntary. It was a voluntary long-term care social insurance program. And so what happens when it's voluntary is that only the people who think they're going to need the benefit sign up for it. And so if you have diabetes, or if your mom had dementia, or if you have dementia in your family, those are the people who are more likely to sign up for it, and lower income people. And premiums become higher and higher because the risk pool deteriorates. Higher income people don't participate, and you end up with a program where the premiums are so high that no one wants to be a part of it. That's what happened at the federal level with what was called the Class Act. And that model simply doesn't work. So this program either has to be universal, or we don't do it at all, and we just stick with what we've had prior. And the reality is, with the private insurance market, their sales have declined by about 90% from around 2000 until 2015. That market is in decline across the entire country. There was a temporary blip last year where it was reinvigorated because a lot of high earners wanted to opt out of walk years to avoid paying in. And so that was more of a tax avoidance strategy than a sincere attempt to acquire long-term care insurance. And most of those people will probably drop those policies shortly thereafter. But overall, the private insurance market just is not affordable for most people. And it's not a solution to the problem facing the middle class of how do we all afford to pay for long-term care in old age. Long-term care insurance costs about $2,700 a year on average across the country. Most of us can't afford to pay that until the day we die. For me, I'm 55 years old. If I had to pay that for 30 years, that's almost $100,000 in lifetime premiums. I can't afford that. Most of us can't afford that.
Okay. Yeah. And Amy, I just want to make sure that you respond to this, because you had said maybe there were some regulatory changes that could help insurance companies get involved here in some way. One last thought on this before we move on.
Sure. And that's something we're just now starting to dive into a little bit deeper. And I want to respond to Ben's comments too. Absolutely. We can't afford the care. We can't afford necessarily the coverage, but the private coverage needs to be an option. And again, there are so many other systemic issues, cost of healthcare, cost of long-term care, that we need to really start to get into to make this viable.
Okay. Thank you for
Brian,
that. Yeah, please.
Can I respond? So I think I agree with Amy on that. I think some combination of a universal program and options makes a lot of sense. So what the Walk Cares Fund does is it pulls us all together as Washingtonians to make sure that everyone has a base level of coverage. And I think that's really important to have us, be able to age with dignity and independence for all of us, right? But then hopefully we'll have a supplemental private market in the coming years, which we're working to develop, where people can buy more private insurance that suits their needs. And that kind of a public-private partnership could really be an ideal solution to meet the needs of everyone.
Okay. Thank you for that. I want to move on to a new topic here. And Ben, I'll stick with you here, and I want to make sure we touch on this issue. It's often left out of this conversation, the impact long-term care has on caregivers. Studies have shown 30% of caregivers die before the person they're caring for, in part due to the stress of the work there. What impact do you think Washington Cares could have on not just people who need long-term care, but the people looking after them? Again, this $36,500 isn't a huge benefit, but I know that's at least part of the equation, what you're thinking about with the caregivers.
Thank you, Brian. That's a great question. And I think what it does is gives people a breather. So I know that when my mom had Parkinson's and my dad had an incident where he fell down the stairs. He's 85 years old, fell down from a cabin in the woods, fell down the stairs. When he was in that situation, and what the family needs in that time is they need money to hire a caregiver so they have time to make a plan. It gives the family time to come up with a plan so that the son or daughter, so I don't have to quit my job, my sister doesn't have to quit her job. We can develop a plan. Maybe we all pitch in a little bit so that 36.5 stretches a little further. And if we're lucky, about a third of people only need long-term care for a short period of time. And then about a year or less, about another third need it 1 to 3 years, and another third need it more than 3 years. For about 2/3 of us, this benefit, combined with some family contributions and family care, can help a family get through the crisis without anyone ever having to go to a nursing home, which is what most of us want to avoid. And so it's not everything, but it can make a big difference in people's lives.
Got it. Amy, I want to talk to you about this. I want to talk about the family caregivers here, definitely very much on the front line of this crisis as we see our aging population living longer here and putting more strain on those families. A lot of these privately managed plans don't pay for in-home care unless it's provided by a licensed caregiver. Is there any room to move there in the insurance industry to try to help out with these long-term caregivers who happen to be family members?
Yeah, absolutely. And I want to echo Ben's comments because the studies do show too, the biggest population of caregivers tend to be women in their middle-aged years, so 45 to 55, which takes them out of the economy, puts them in the same situation their parents or the people they're caring for are in. So it is critical that we provide respite care or support for caregivers so that they are not having to set themselves back and then end up in these same situations. So yeah, absolutely. I think the carriers, and yes, they are our members, but I certainly don't speak for them as a whole, are willing to really think through this because it is a critical issue. It needs to be addressed. And are there some solutions? As Ben mentioned, there's got to be a mixture. It can't be one solution at all, that covers all. We have to look at options.
If I could respond to that, Brian, I would agree with Amy on that.
Mm-hmm.
I think it's really important that a program like Walk Cares is not just good. It sounds like it's social policy, right? Mm-hmm. But it's not just good for the people who need care and for their caregivers. It's also good for the economy because it's good for businesses. Amy mentioned, and it's truly the case, that it's women in the prime of their careers, their most productive years, often 45 to 55, who can be taking senior leadership roles, who are often forced to take a step back and not accept promotions, not take on senior roles because they are caring for loved ones. It's much more efficient for a person like that to be working in a company really helping the state's economy rather than caring for their mom or dad. If a professional can come in, that could be good for everyone.
Okay, thank you for that. We need to wrap up the show. I need a 30-second version here if you could, Ben, talking about this. Where do you want this conversation about Washington Cares to go in the months ahead? What's the best case scenario for you in terms of what's coming out of the legislature this session?
I think it's just really important that we understand that this is a problem that's, the age wave is coming. It's like a tsunami coming towards us and we're standing on shore looking at it. It would be foolish to not prepare for it, right? And, there's a lot of different ways you can go about it, but Walk Cares is the only approach that we know of that will address this problem for everyone in the state and give everyone affordable access to affordable long-term care as they age.
Great. Amy, final thoughts from you. I'll let you have the last word here. Best case scenario for Washington Cares as we work through this session.
Sure. I think we need passage of the two bills, 1732, 1733. I see that happening. And then hopefully some good dialogue over the next 18 months to find some real common sense solutions that provide options and do meet the needs of Washingtonians for their long-term care issues.
Great. Thank you both very much for this. And we will be right back. What are people saying on social media about Washington's controversial long-term care payroll tax? One group writes, what should not be on the table this year or in future years is elimination of Washington Cares. Another says, Democrats are now trying to delay implementation, but this onerous tax needs to be made completely optional. We'd like to know what you think. Send us an email at contact@seattle.gov or find us on Facebook, Twitter, and Instagram. Coming up next time, a bipartisan proposal to close the wealth gap in Washington with baby bonds. Will creating a trust fund that children can access in 2 to 3 decades help solve intergenerational poverty? We take a look at the Washington Future Fund on the next City Inside Out. I hope you join us.